According to the Pew Research Center, nearly 92,000 Americans died from drug overdoses in 2020. That's a 30% increase from 2019. But black men are now at the center of the epidemic. Black men registered the largest increases of overdose deaths. In 2020, there were 54 overdoses deaths per 100,000 black men in the U.S. Since 2015, those deaths have increased by 213%. And as equally concerning, overdose deaths for black women have risen 144% over the same period. Drug treatment experts have attributed much of the rise to the pandemic. They cite less access to drug and mental health treatment and the surge in fentanyl use as the primary factors contributing to the surge. Joining us to discuss is BNC Chief Medical Correspondent, Dr. Corey Hébert. So, Dr. Hébert, what's going on here?
Yeah, this is sobering news for a lot of people, but in the medical realm, we deal with this every day. So let's look at this. We look at the social determinants of health. Those are the determinants where we decide where you live, where you love, where you work, and where you play. We cannot look at any health outcome without looking at these things. So right now, during the pandemic, where we live, where we love, where we work, where we play, all these places have been totally devastated, demolished, decimated because of COVID-19. All of our support services, all of our being able to interact with our family and friends, all of the support that we would have as African American men and women, it's just gone. So when you feel depressed, what do? You have to escape. How do you escape? You either escape through alcohol or drugs. Now the issue is that the opioid epidemic totally just black people didn't have an issue with the opioid epidemic, and we know how racially polarizing that was, because when it was the crack epidemic, everybody went to jail because it was black. When we got the opioid epidemic, everybody started saying, "Oh, we need to have our children with their mothers, no matter if their mother is addicted to heroin or not." Right? So it was a really big deal. But when we started to look at how things have been going after COVID-19, African Americans started to use more opioids and could not get them from the doctor, because doctors do not prescribe African Americans opioids by and large. So we had to get them on the street. And the biggest thing that we have seen, and some of our really big entertainers have succumbed to this, is this fentanyl and the synthetic opioids. This is where they are many times stronger than heroin or morphine. And what happens is, when you deal with the fentanyl, then you do the really bad, horrible overdose. And that is what we are seeing with our young men in the street, because the fentanyl is cheaper, and you cannot get those pills like the Dilaudid and the morphine pills. So those are expensive. So you go to a cheaper alternative, which is fentanyl, which is 100 times stronger. And that's why we're dying from these overdoses.
So do you see this as an outgrowth? I mean, we were talking about all the violence being an outgrowth of the pandemic, like a social trauma. Is this another social trauma outgrowth of the pandemic that we are not treating necessarily well enough?
Well, absolutely, because we don't have access. That's another part of the social determinants of health. We have no access to healthcare. We didn't have access to healthcare before the pandemic. So now, not only are you depressed, you can't get your medicine because you can't go to your doctor. You don't have a job because you've gotten laid off. You don't have any money, and then you can't get to a psychiatrist because all of the services are stressed. You can't get to your therapist because the services are stressed. So now, what do? And so this is a social ill that, just like we talk about all the time, when white folks get a cold, black folks get the flu. So anything that is happening to the white community is going to be amplified in our community. And once again, anything that's amplified in our community, black men are going to get the brunt, because black women are taking care of business. Black women are graduating from college, finishing, trade school, all these things that black men are not doing right now. And a lot of it is escapism with alcohol and drugs. And when you start mixing alcohol, drugs, depression, and violence because of the lack of and scarcity of supply, then that's a recipe for disaster. And so we're seeing a lot of our indices for African American men even getting worse and worse, including deaths from COVID-19 through this pandemic.
So this is the last question. From a medical perspective, what do you advise that people do? There's just a lot of stresses on a lot of people who have less, and many of them who are black. Rising cost of goods affects people with less money, not more. If I have $1 million, it doesn't matter to me if bacon is $3 or $5. When you have a little bit, it does matter a lot. It does matter if
Sure.
you can't get out and socialize in ways that you used to, and affects people with fewer resources and less money more. We're about to, have pressure put on us around voting. There's all sorts of stresses around everyone, which may be adding to people's pressure to use more drugs. What do you suggest that people do when they don't have access to their therapists and their doctors?
Yeah. Well, this is what I recommend. You have to admit that you have the problem. And if we could get past that as African Americans, we'd be in a much better place. As Black men, we do not admit any weakness. We don't admit if we have to go get a prostate exam. We don't admit we have to go get a colorectal exam. We don't admit that we have to check our hypertension, our blood pressure, our diabetes. We don't check any of that stuff because we are strong Black men and we don't need that. And until we get over that stigma, then we are always going to be the ones that have to escape the most because we're the ones that never want to address our own issues.